The background for the project is, as with some other projects in this webinar series, the demographic development. As you know, there is a global awareness of the future challenges with the demographic development, where both the number and the share of older people in the populations is increasing rapidly. And when a number of older people increase, also will be an increase in long-term care needs, as needs for long-term care is more common among older people. And there are some research, and you can see that it said that, well, the aging population now is healthier than ever, and that is true. They are healthier now than they have ever been, but the 5% of the older people that have always needed a lot of care, they still remain, and since the total number of older people is larger, also that group will be much larger. And there are a lot of financial challenges connected with this. First of all, because the group of people in the populations who are working and bringing the taxes in, paying the taxes, is getting smaller. The proportion of them is getting smaller. And also, since the costs for long-term care is getting bigger, there is not enough money to provide the long-term care. And you're probably familiar with, in all of your areas, how there has been, over the last 20 years, cutbacks in the care sector. 80% of all care given to older people is provided by family carers, mostly spouses, but also children. And when we're talking about older people, children can be in any age, but it's adult people. And if you would take into consideration that the 80% of care, despite the financial challenges that society is having today, and all these people do care for free without getting paid for it, so if the family carers would not continue to give the care, all the expenditure for that would end up on the municipalities, at least in Sweden, because here municipalities are in charge of providing care for older people. For the family carers, it is a tough situation. There is usually a lot of carer burden. They become isolated from their caring duties. Many of them care for a person with dementia, and you cannot leave the person alone in the house, so you lose your social life. And depression and other illnesses are more common among family carers than among other groups. And that's why carer support is very essential, both because we want to keep the carers in good health, and also for society's reason, that society needs them to keep caring at home. Most people want to remain in their own home, and by having a family carer, that is possible to stay in their own home longer and delay nursing home placement, and also delay the need for home care by professionals. Most of us come from rural areas, or probably all of us, because that's one of the themes that we have in common in this in the Improve project. And when it comes to rural areas, we have specific challenges. There are long distances and fewer available services, so it can be difficult to access carer support. In Sweden, we have a law since 2009 that municipalities are obliged by law to provide carer support for the reasons that I mentioned before, to help them keep up their role. But in the rural areas, there isn't always carer support available. There is on paper, because there is somebody who has the job as being in charge of carer support, but a lot of times that is only one person with very limited access hours. There is an ongoing loss of services where in rural areas services are closing down. And there is also an ongoing depopulation where the younger people move away, and remaining in the area is a large proportion of older people. And many of the chronically ill in rural areas are cared for at home by a spouse who doesn't get out of the house a lot. There is also a lack of healthcare professionals. It is very difficult to recruit staff to the rural areas, which makes the availability even more of an issue. And for carers in rural areas to have equal access to carer support, it is essential to pursue new ways of providing that support. And using the possibilities of technology and e-health services to reach people in their homes open up for new opportunities to provide equal support to carers, regardless of where they live. And research since many years back have promoted technology and digital alternatives as necessary in order to meet future needs. And based on that research, we started a project where we wanted to reach family carers in sparsely populated areas and offering them a good, flexible and interactive support. And we did that in a collaboration between 15 municipalities in 3 counties. Rural can be explained as different scenarios. And I just wanted to, before we go on further, to introduce you to the area where the project took place. As you all probably know, the EU and OECD use definition of rural, where they call rural an area that has less than 150 persons per square kilometer. And in Sweden, we have, there is a government definition that says that rural areas classified as rural in Sweden are areas with less than 7 persons per square kilometers. And the area where this project took place has an average of 4.5 persons per square kilometer. So as you can see, it's great variety in how rural is defined, and it gives you an idea of the distances and also the surroundings that the project was taking place in. And when you drive around our area on the main roads, you can also see that there are some very creative initiatives to defining rural. And I couldn't help but putting this McDonald's picture in here because I think it's kind of interesting that you know, McDonald's have road signs along the road telling you how far it is before you come to the next restaurant and can make a stop. And here McDonald's have really put the effort in to announce that in only 2 hours you will reach the next McDonald's. The web-based support that was used for the project was a support service called the Action Service, and it originates from an EU initiative and has been further developed over the years. And in the Action package, there is a provision for the participants of a computer with web camera that they have in their homes. They get access to high-speed internet. There is included information and education software related both to different kind of illnesses and the caring situation, but also with a lot of information about coping strategies for the carer. Games are included, and also there is a feature of an online community where both professional action call centers are included and also all the carers involved in the program. So it becomes a community where they can access peers with web camera communication. And the role of the professional support staff was both to give carers support and support them in their carer role, but also to educate them and support them to use the technology. So the professionals in this case had a double role. Main achievements and results from the project. I have tried to summarize in this picture here. There were, it was a large project with a lot of participants. We will go into those numbers a little further on. And there was an enormous output of results. So what I have been able to show you here is just a short summary. And if you are interested in finding out more details, you're free to contact me after. But summarizing the results, first of all, what we intended from the beginning was to see if carer support through web-based services can be used in rural areas and be as good as the traditional service, or hopefully at least good enough. And we found out that using web-based services enables for carers to access carer support, which was the first thing we wanted to see. And many persons who were not able to participate in the traditional support could reach support, find support through this service. And another thing that came up as really important was that the carers said that they could design the content of the support to match their own current needs. No matter what their situation was, they could find support that was relevant to them. Whereas when they compared with traditional support, they said that they were they had to participate in the support that was available, no matter if it was related to their needs or not. They could also have control of when the support was given. Many carers reported that they want to access support late in the evening or sometimes at night because they have trouble sleeping. And the traditional support that is dependent on persons responding from the municipalities are always closed at those hours. Empowerment was one of the major outputs as well. When the carer became in control of their situation, they managed on their own a lot more and needed much less professional support than they had before. They also reported increased quality of life, less isolation, and higher competence as carers, which of course was great benefits for themselves, but also benefits for the person that they care for, that they now, through the web-based service, learned how to care properly and learned more about the medical conditions. Among the findings from the web support group that is relevant to lift up, I think, is there were many interesting results that we had not anticipated to get. One of the things that they reported were that they got very much more contact with their grandchildren than before. They said that before it was usually that the grandchildren called them on their birthday and they didn't have much contact in between. But when the grandchildren found out, and now we're talking about children or teenagers or young adults as grandchildren, they thought it was really cool that grandma or grandpa was on the internet. So the grandchildren started having much more contact with the older people and also asking them for advice. For example, oh, I'm going to make an apple pie. I don't have a recipe. Grandma, can you tell me how to do? So the older people also felt that they became much more involved in the young people's lives, which made them feel really great. They also developed their self-esteem and felt very proud of themselves. They said that I had thought that this with computers was really difficult and it was nothing for me. It was something that contributed to me being excluded from society. But now, when I managed to do this, I feel like, first of all, I have overcome the technical challenges, and also I feel included in the digital society. There are, of course, some factors that we have identified as critical success factors for achieving the positive results. It's not so easy that you can stick a computer in the hands of an older person, or if you can say that, hey, we provide web-based support. Most of the people in this group had never used computers before, and they were in need of a lot of support, first of all, to start to use the technology, but also not only start using the technology, but also get used with the web camera communication and to learn to have distance relationships and not IRL relationships only. And one factor there, I would say, if I was only to lift one factor, I would say that intense user support initially in the project, they needed a lot of support. And they also stated at the follow-up that the troubles that had happened initially, they didn't really feel they were troubles because the professionals had helped them to overcome it. And the figure that is on the slide here, it's a theoretical model that researchers has developed that illustrates the importance of having a lot of support when you start using an e-health intervention. Because just giving the technology and starting the intervention is not enough. In order to keep the users using it and for them to realize that they actually can benefit from it, you need to help them out a lot and invest in initial support. But at the end, you will get users that are empowered and can self-manage, and in the end they will need less professional support. So in the long term, it's a good investment. The second critical success factor is to have collaboration between several municipalities. You need to reach a critical mass of both users and professionals that can be on the call center, because one of the purposes of having web-based support is, as with other web services, that they are always available. No matter what time of the hour that you need the support, they should always be available to you. And if the municipalities try to do this more on their own, you will never be able to have the service open 24/7. And that's also then a reason for the users not to use it. A couple of users who had stopped using the service within the project time said that, well, I called for support and no one answered. They're not open in the evenings when I need support. So that's also very important. If you would want to implement this practice in the planning, it is important to think about the collaboration between municipalities. One thing that we learned, a mistake that we did, was that when we initiated the project, the intention was to have one call center in the whole area. But then the different directors of the elderly care providers in the municipalities said that, well, we don't think that the older people in our municipality are interested in calling another municipality for help. We think that they want help from somebody that they know and someone who's from close by. So we ended up with a lot of call centers serving smaller areas, and that resulted in limited availability and limited open hours. And the users, the older people that is, said that they got frustrated when they called their own call center because they had limited open hours. So instead they choose to call other call centers. And there was one call center that was always open. And by the end of the project, it turned out that most users, they didn't call their home office call center, they called the one that was open always. And they also stressed that it doesn't matter who I talk to or where they live, I want them to answer when I'm in need. So that's really important to think when you plan, that you have enough backup to keep it always available. As far as development go, I was thinking on the headline development, I was thinking about development of services. We used the action service that was ready-to-use service. It's a package that you buy, and in the package is included that you buy specific software, and for us it was also specific hardware. And in the end, I don't think that's a sustainable solution, because the development within technology goes really, really fast. So from the planning of our project, where we decided on the action service, and until the evaluation of our project, technology developed so much. It went from the iPads came during this time, and also a lot of open access to different platforms online. So what happened was that a lot of the users said that, well, I started off by using what was included in the action service, but through my grandchildren, they taught me that there are so many things online that is easier to use. So they started to use Skype, for example, and Messenger, and a lot of other services that are open to public use. And they felt those services were better because they could include whomever they wanted in their online networking. In the secure community included in the action service, you were only allowed to participate if you were an action user yourself. And they said that we want others to be included as well. So as far as development goes, I would recommend use common services and keep it easy. There are a lot of common services that have been developed over the last 2 years, both in Sweden and also initially. Carers UK, for example, have a platform with similar services that can be accessed online by anybody. And deployment of the good practice. I think that the carer support services in each municipality, or, sorry for changing the picture there, is essential. And how that goes, of course, depends on how it looks like in your municipality or in your area. And what we also found, and what is usually the case for any service, if the service is attractive and if it gives the user benefits that make their lives easier, it will also self-spread. And we were called up by several older people in these areas that said, well, I want to be included in the service as well. I've heard that it's really great. As far as acceptance goes, it is crucial to talk to the healthcare professionals. A lot of the acceptance and how well it goes is correlated with their attitudes. And what we found out was that the care professionals had a different view on how the project was going. When we asked the older people, the carers who were involved in the program, how often are you using your web services, most of them said they were using it basically every day, or at least several times a week. And when we asked the professional support staff, how is it going for these people, and how are they using it, the staff said, well, it's not going really great. We hardly ever hear from them anymore. And the conclusion we drew in the project was that in time, the carers didn't need the professionals so much anymore, but the professionals had a tradition of valuing their work in how many contacts they have with their clients. So the professionals needs to be aware that using technology and web services means new roles. As a professional, instead of giving the support in meetings with the client, you become more of a coach to the client, coaching the client how to manage on their own. And secondly, I think it's important that the staff is very aware that technology is not a tool to replace staff and to replace in real life meetings. In our rural areas, at least, if we don't use technology to fill the gap that has occurred due to lack of staff, we will not be able to provide the services needed in the future. And it's not really a matter of future, we're already there. We have a great shortage of health staff already. The good practice that we used, or that this presentation is about, the action service, was thoroughly evaluated, and that's why we have so much results. And it was we designed the whole project as a research study with a comparative design. We wanted, as I said before, both to see can it work in rural areas to provide web-based support, but we wanted also to compare it with the traditional support that was already there. We recruited 95 spouse carers over 65 years old. All of them cared for a spouse in their own home. We allocated the carers to an intervention group that received the action service and a control group that received the traditional carer support. And the traditional support varied between the municipalities depending on what was available. But usually traditional support is group meetings and also personal counseling, usually based on IRL meetings. We decided on a long-term follow-up and to have a follow-up after 1.5 years. If you look at research for similar projects or e-health interventions for older people, there is usually a follow-up for around 3 months or mostly 6 months. But we figured that to test the sustainability of the service, we wanted a longer time span because many carers care for many, many years. And if you're going to invest in something that is as different as this, you really need to know that it is sustainable and what happens over time. We used a mixed method for data gathering and also for analysis. It was a combination of qualitative and quantitative measures. And the qualitative data was interviews. Because of this large area that we're in, we choose web camera interviews to have with those who had the web-based support service, and we did telephone interviews with those in the control group, and both of those were analyzed with the research analysis method called qualitative content analysis. And for the quantitative measures, we used questionnaires, and we calculated logistic regressions and also comparative statistics. I've been mentioning the sustainability of the project a couple of times because I think that's really essential when you start a project to think of the sustainability already at once. And especially in a case like this, when it's a project that wants to test something that could have great impact on future service provision. And for sustainability, I would say that, again, this is pretty much a repeat from what we have been going through before, but it's really essential. Generous initial support is key. There is plenty of research that supports that, and it's really, really important. When you're looking at the financial situation, our municipalities usually ask, how much does it cost when you have an idea for something? And it costs more in the beginning because the staff needs to spend time with the carers, but it will pay off in the end. Keeping it simple, avoiding specific technology, keeping it to whatever is available, and There are a lot of solutions that have developed over the last year, actually. So that's not a problem. People will demand web solutions. That's why it's important to provide web solutions. There is a criticism that often comes up that, well, older people cannot use technology and they're not so much interested. Well, to a part that is true for those that are among the oldest old at the moment. But if you look at those 65 to 75, they're not hostile to technology, and many of them have computers already, and they want the web-based services because it makes their lives easier. Cooperation between municipalities, so you can get a group that is good enough for the 24/7 availability. Those are the key points for sustainability of the service. And finally, for transferability, the lessons learned is that staff attitude is a challenge that needs to be addressed really early because it affects the implementation. And again, not using specific technology because the development goes so fast. So if you invest and buy specific technology, by the time it is wider implemented, the technology will be considered ancient and not fulfilling its purpose. So the recommendations I'd like to send with you for is collaborate, keep it simple, prepare the staff, use the theoretical framework for guidance, and again, it cannot be stressed enough, initial support to the users must be generous. And by that, I would like to thank you all for listening and hope that you have had an interesting time and that you managed to keep your focus despite the little messy technology in the beginning here. And I'll be happy to ask questions if there are any, or otherwise you're free to contact me later if you like. It's been a great pleasure working with this project, and I would be really happy to share my experiences and knowledge with you so you can get going with something similar. So thank you very much.
Thank you, Madeleine. Any questions from anyone? Please do that in the conversation window. If it is not open, you can click on the talking balloon in the lower left corner.
Okay, since I cannot hear you, you need to write the questions. Okay, there is a question here about how long they used the system, and we did the follow-up. They used the system for, well, the plan for the project was 3 years, but we did the evaluation after 1.5 years. So all the results are based on using it for 1.5 years. I think all of you can read the questions, but if not, there is a question about how we prepared the staff and if we designed some courses or teaching material. And the staff was prepared. We have, there is a network with all the, as I mentioned in Sweden, it's the law that each municipality must provide carer support. And in each municipality, there is also one person that is hired for that specific purpose, and they have a network where they meet together, and so they were all educated by one person who is a specialist on providing support in the action service system, but that was the training they got, and we were not prepared for the attitude difference. And the teaching material and everything was provided by the company who provides the action service. They have a program for that. I think now, since we have so much experience of our own, we would make up our own introduction and teaching programs for the staff. Okay, I move on to the question from Ivar Petter regarding if the system could be used by the professional when they are at remote locations to be in touch with other experts for second opinions, etc. And that is my, I think, yes, I would say absolutely yes on that. And we didn't have that kind of activities included in this project. It was this project was limited to the municipal staff that gives carer support, but I was actually surprised of how advanced medical tasks that the carers are doing, and many of the carers also said that why can I not use this web camera to get in contact with my doctor or the nurse and get more medical advice. And that was a really good idea of them, and I thought also too that that is something that we should broaden our perspectives and include, and not see it as only a means for carer support, but for their whole situation of needs. The initial IT support was provided by the company who sell the action service. And they trained local municipality staff to be able to give support to the carers. But basically the action company was in this all the time and put also a lot of time into it with support, technical support that is. Yes. If any of you are interested in further reading about this, I can mention that I did my PhD right on this program, so there is a whole book, my dissertation, that covers this more in detail, and there are also some articles that have been published in research journals regarding this project. So I could actually bring another picture into the slideshow and send out where you can find the references if you want to read literature.
Okay, thank you, Madeleine. There are no more questions, at least not for the time being. So probably we should.
So thank you all, and thank you for the questions. I'm really sorry I couldn't hear you, and I hope that you had a great time nevertheless. And now we're going to change for our next presentations here from Västernorrland, the eSpin project. And we suggest that we take a little break for coffee or just stretching your legs, and we will set the new presentation up.